Hi, everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Forbes contributor, Dr. Omer Awan. Dr. Awan, I appreciate you coming on.
Yeah, thank you so much for having me. Appreciate it.
We've heard about the newest drug for rapid weight loss, which is Ozempic, not originally a weight loss drug, but that's what it's being used for now. So, can you tell us what is Ozempic?
Ozempic is a drug that's been approved by the FDA to treat type 2 diabetes, to decrease blood sugar levels. And it's a GLP-1 agonist. That's just a fancy way for us to say that it mimics the normal hormone GLP-1 in your body. And what that does is that it stimulates your pancreas to secrete insulin, which then decreases blood sugar levels. And that's why it's so effective for diabetics to decrease their blood sugar levels.
So, this isn't insulin, right?
It's not insulin. It's definitely not insulin, but it helps the body secrete insulin, which then decreases your blood sugar levels.
Sure. So it's originally used to treat type 2 diabetes. So how did people find out, oh, this also is really good at weight loss?
Absolutely. So Wegovy, which is another drug that's in the same class, which has the same active ingredient as Ozempic, is used and FDA approved to treat obesity. But there's been a shortage of Wegovy, so a lot of people have, turned to Ozempic to treat obesity and to try to lose weight. And there's been a huge emphasis of Ozempic on social media, which has really triggered a lot of people to sort of use this drug for weight loss, even though it hasn't been FDA approved for weight loss.
And I want to talk about the impacts that it has on people who actually need it. How is this impacting people who have type 2 diabetes and rely on Ozempic?
It's having a huge impact because unfortunately what's happening is people are using this drug to lose weight. They want to use the drug to shed 5 or 10 pounds before a wedding or something like that, but that's decreasing the supply of Ozempic for people that actually really need it. And the people that need it are type 2 diabetics, who want to decrease their blood sugar levels. So unfortunately, it's halting them from using the drug that they really need.
You mentioned that people are using this to shed just a few pounds for events like a wedding. That doesn't sound like they need it really for health reasons. So how are they getting their hands on Ozempic?
Well, I think, from the COVID-19 pandemic, there's been a lot of change in the way people are getting medication. So now there's, telehealth, people are able to get the medicine online by, filling out prescriptions that then, doctors that use digihealth and telehealth are able to prescribe. And it's increased access to drugs. And in some cases, this access is good. It's allowing there to be, more transparency and more availability of health services. But in other instances, it may not be very good and very effective for the public health at large because doctors who are prescribing these don't know the whole history and don't know the big picture of patients without actually seeing them face to face. So it can have detrimental consequences. And unfortunately, this is how people are getting Ozempic, fairly easily in the market.
Sure. And I do want to talk about the side effects here. I mean, first and foremost, is this safe to use for weight loss if you aren't a type 2 diabetic?
So in general, Ozempic is a very safe drug for type 2 diabetics. It doesn't have, that many serious side effects. Common side effects are things like nausea, vomiting, constipation, diarrhea. In a small percentage of patients, there are more serious side effects like inflammation to your pancreas, inflammation to your gallbladder. You can have hypoglycemia or low blood sugar levels, and you can actually have an allergy to the active ingredient semaglutide. So if you do have, itching in your throat, you develop a rash, you have difficulty breathing, you may have an allergy and you should see your doctor immediately. But patients that don't have type 2 diabetes shouldn't really take this drug. It is effective in weight loss, but you're preventing people from who actually really need it getting the drug. And on top of that, there are side effects that we just talked about that should be considered.
I know you're saying to people you shouldn't use this if you're not a type 2 diabetic, but obviously it has gone viral. It has really gained momentum and popularity. So people are using it. So let's say someone is using it, one of our viewers is using it to kickstart their weight loss journey, and they see some results. If they get off Ozempic, will they gain that weight right back?
A lot of studies have shown, yes, that that's the case. So Ozempic is really meant to be used for the long term. We're talking years, maybe 10 years, 20 years, 25 years. Often people are using this drug in the short term, again, maybe for a couple of weeks, months, to shed off those 5 or 10 pounds before a wedding. Typically patients that do that and they stop the drug will end up gaining that weight back in a matter of a couple of months, 2 or 3 months. So really, this is not a short-term drug. This is really a drug that's meant to be used for the long term.
And if this is a drug that's meant to be used for the long term, how are doctors prescribing it just for that short term time? I know you said that people are doing this based on telehealth, but how are they getting this just for a few weeks?
Sure. So, it's an off-label use, right? It's an
Mhm.
off-label use, which doesn't make it illegal to prescribe. So doctors do have the capacity to prescribe a drug, even if it's not FDA approved for that indication. And I think that's what's happening here. So, patients are coming in, they want to lose weight, and doctors are able to do this because they don't have, legal ramifications for prescribing it if, some of their patients are coming in and want to lose a little weight.
I do want to talk about the bigger picture here for a second because we saw a similar problem with ADHD medication a few months back. There was a shortage of that too because doctors were prescribing that to people that might not need it. Do you think telehealth is the way of the future or that should be curbed?
Well, I think there's pros and cons. I think that telehealth is the wave of the future because it allows greater access. There are communities that lack access to real health. We're talking about underserved populations, patients that live in areas that can't go to a hospital or can't see a provider and may have to travel hours just to see that, right? So, this actually mitigates some of those problems and allows there to be really high quality care and high quality health. But the flip side of this is that we get this problem. We get this problem where, we don't see a holistic review of the patient. We are not aware, doctors aren't aware of the whole picture. They don't have the entire medical history of a patient, yet they're prescribing drugs. So this can potentially be a problem, and it leads to certain problems like this, like we have overuse of a drug where certain patients are getting it, but then the patients that actually need it aren't able to get the drug because so many people are actually getting the drugs so easily.
Dr. Awan, what is the solution here? Because there are pros, there are cons. How do we compromise?
I think we just have to be vigilant. I think all of us as a community, as physicians, have to do our part and our due diligence when we're prescribing drugs, try to gain as much information as possible. And even if we do telehealth, it doesn't mean that we don't see a patient. We can get on a Zoom call, just like I'm on a Zoom here right now with you, Brittany, and we can talk, discuss our health issues, and then make the most appropriate care and treatment when we're prescribing drugs that's best for the patient and best for, the society in general.
And Ozempic obviously opens a larger conversation to weight loss in this country and body image, things like that. You're a doctor. What would be your recommendation for people to safely lose weight if needed?
Well, they need to, first of all, diet and exercise. That's the best way to lose weight. The second is to talk to your doctor, consult your doctor, develop a plan to try and lose weight, and then go and tackle drugs that have been FDA approved to treat obesity. And it should be something that is in the long term, something that's not, for a week or two, but something that is going to allow you to reach your goals in a sustained period of time.
Dr. Omer Awan, thank you so much.
Absolutely. Pleasure to be